association with the Tribune is very long. I have very sweet memories. I think for last more than 50 years, I can miss my breakfast, but I have never missed reading Tribune. It's I must say, the Tribune, as the name indicates, the truth. They have maintained this tradition till date. Though I consider them in the League of Freedom Fighters, they showed one photograph of Shahid Azam Bhagat Singh. ਜਦੋਂ ਕਿਤੇ ਵੀ ਸ਼ਹੀਦ ਆਜ਼ਮ ਦੀ ਗੱਲ ਹੁੰਦੀ ਹੈ ਮਤਲਬ when you see I don't want to do any politics, but one of our very senior leaders said that Jawaharlal Nehru never went to meet Shahid Azam Bhagat Singh. The fact was that he met him in jail and the Tribune was the evidence. So then somebody tweeted that this is not a fact. So it played a very crucial role in the freedom struggle. Whatever history I had read, so I think it was the leading newspaper that time during the freedom struggle, and ਇਹਦਾ ਬਹੁਤ ਵੱਡਾ ਇੱਕ ਯੋਗਦਾਨ ਰਿਹਾ ਇਹਦੇ ਵਿੱਚ. Dr. P.N. Chutani, he was the chairman of Tribune Trust, so he was like a father figure for me. We were working in International Physicians for Prevention of Nuclear War. And ਉਹਨਾਂ ਦੇ ਘਰ ਜਿਹੜੀ ਕਾਪੀ ਆਂਦੀ ਹੁੰਦੀ ਸੀ ਉਹਦੇ ਤੇ ਜਿਹੜਾ ਐਡੀਟੋਰੀਅਲ ਲਿਖਦਾ ਸੀ ਬੰਦਾ ਉਹਦਾ ਨਾਮ ਲਿਖਿਆ ਹੁੰਦਾ ਸੀਗਾ, and many times you see we would know okay, what is going to be in the news tomorrow. So एक बड़ा I want to congratulate Tribune for maintaining their, I would say, individuality, freedom, sticking to the principles of journalism. And many people, particularly digital media people, they need to learn a lot from Tribune. I hope if the media is as truthful as the Tribune, then we won't have many problems, even including doctors. There will be no blackmailing of the doctors. So you are going to reward my colleagues. That is another, a big thing for me. That तुसी मेरे जड़े profession दे बंदे आ, तुसी उन्हों नो, you are going to recognize their talent. So I thank you for that, being a member of the doctors community. And I would like, very briefly, I will share my vision of the Punjab government, what the things we are trying to do, different things, or trying to do it differently. The first is that healthcare is given at 3 levels: primary care, secondary care, and tertiary care. Primary care is basically provided by the government, and private doctors, they work in secondary care and mostly in tertiary care. So primary care was a neglected field. Pakistan government, actually it's a Arvind Kejriwal or Delhi model as we call it. So it's a revolutionary kind of thing, that this concept of Aam Aadmi clinic or Mahalla clinic. So in the cities, every 500 meters or 1 kilometer, you have Aam Aadmi clinic where doctor is available. It's a very neat and clean, small unit. There is a clinical assistant, there is a pharmacist. It assured supply of 80 drugs, 80 medicines, and 38 diagnostic tests. It is for the first time that the tests are being done in the primary care. This is for the first time in the entire country. It's very rare even in most of the developed countries. So, till date, 2.5 crore people, they have visited Aam Aadmi clinics, and majority of them are in rural areas. You see, we have an epidemic of chronic kidney disease or renal failure. A lot of dialysis centers has come up. I'll come to that later. But the two reason is undiagnosed and untreated diabetes and hypertension, lifestyle disorders. So we are addressing that problem. So out of 2.5 crore people, 1 crore people, they have come to the hospital, to the Aam Aadmi clinic once. But they were satisfied, they got the medicine, they got good treatment, they are hypertensive, diabetics, respiratory diseases or any other chronic disease. They are coming repeatedly, and 1.5 crore people are those who are coming repeatedly to the Aam Aadmi clinics. So our OPD has increased almost 1.5 times. So similarly in secondary care, we have the assured presence supply of drugs 276, we call it essential drug list. They are available in all the government hospitals of Punjab. And 254 more drugs which are not there in the EDL. So we have provided them funds for that. And then X-ray and ultrasound, we are collaborating with the private sector. That's what I will come to. Then in the tertiary care where the private doctors, they have the leading role. Most of the beds are with them, most of the technology, most of the, you see, all kind of tertiary care is with the private sector. But Punjab government has also started that. We have Punjab Institute of Liver and Biliary Sciences in Mohali, which is state of the art. It's like any other private or corporate hospitals. Then you see all our medical colleges, in the coming 1 year, we will upgrade them to postgraduate training institutes on the pattern of PGI. We already have super specialty wings. We have cardiology and neuro. Dr. Bishop Mohan is here from DMC and Dr. Wander. In collaboration with them, we have a STEMI project where all, you see, heart attack patients, ST wave elevation, myocardial infarction patients, they are thrombolyzed. Punjab government is providing the injections worth 30,000. So similarly with Dr. Jairaj Pandian from CMC, we have a stroke project. Again, you see, mechanical thrombectomy costing 6 lakh is being given free for the patient. So these are our collaborations with the private sector. And then there is a very good NGO in Ludhiana itself, where Helpful NGO, we had a community health center in CSC. We have given them the premises. They have about 25 machines, dialysis machines, where the dialysis is done free of cost. That is NGO supported, and they are going to add another 20 machines. And the latest machine with double filtration. So lot of NGOs are coming forward. Dr. Sobti, and there is a nephrologist from DMC who provides his free services at this dialysis center. Dr. Sobti goes to our government hospital. So I request all the doctors present that you can donate maybe once a day or one half day in a month. And you can go to a government hospital of choice. You can offer your services, and that way your services will be available for the poor and the downtrodden. We will provide you everything. We will provide you staff, premises and medicines, everything. But we are short of specialists. So I am looking forward to collaboration with the private sector. We are starting new courses like critical care, geriatric for the elderly, palliative care for terminally sick patients. So in all these fields, we are collaborating with the private hospitals also, with Fortis for EICU. So we are working together. So our Chief Minister's vision is Sarangala Punjab. Together, the Tribune, the doctors, the businessmen, and you see, even I request the businessmen to invest their CSR funds in health or education. That way you will become more popular, your business will grow, and everybody will benefit. If you have a healthy Punjab, like if you have a drug-free Punjab, if you have a drug-free Punjab, then you will have a crime-free Punjab. Coming to the drugs, it's a serious problem, it's a global problem, it's a national problem. It's not a Punjab-specific problem, but we will give the Punjab model. Like we have given a model for primary health care. We have a model for road accidents, we call it Frishte scheme, and a Sadak Surakha force. Every 30 kilometers, there is a vehicle. It's a latest vehicle with gas cutters, trained staff. So that vehicle will reaches the accident in 5 minutes, and the patient reaches within 15 to 20 minutes, what we call as golden hour. That makes all the difference between life and death. So all our patients are reaching the hospitals, and we have empaneled all the hospitals, whether government or private, on the highways, state highways and the national highways to start with. And the treatment is free, whether the patient is from Punjab or from any other state or from any other country. If the accident happens in Punjab, the treatment is free. It may cost 5,000, it may cost 5 lakh, it may cost 25 lakhs. We will pay the entire cost of that. Punjab government is paying the entire cost of that. So I think it's a first of kind of initiative. So I urge the business community that they should invest CSR funds, and you can come forward. You can start a medical college. We will give you the land. We will work together. We have a government hospital. You run a private hospital. You see, you can donate 10% of the beds for poor patients. If you have a 500-bedded hospital, you can donate 550 patients for the government, for poor patients, and then you can charge for 450 patients. You can do medical tourism. We want you to do medical tourism. We don't want our patients to go to other states or other countries. The people from other countries and other states should come to Punjab. That is where we want to take it. So I look forward to the cooperation from the media, and I look forward to cooperation from my colleagues. They must donate their time. They can collaborate in many ways. We are short of gynecologists. We are short of anesthetists. And you see, we are working with private doctors on empanelment mode, like Aam Aadmi clinics. So it's very successful. We are doing successfully in Tarn Taran, where we didn't have a gynecologist. We have done it in Malerkotla. So you can donate. You see, even we working part-time in a government hospital. But you must be honest to the extent that you treat the government patients from the government hospital there only. Don't take them to your hospital, and we keep an eye on that. We have a very robust, you see, IT-based system now. Our primary care is totally IT-based. It's totally digitized model. We are talking to the patients, we are getting feedback from the patients, and we have discovered many things. And ever since we started patient feedback mechanism, the outcomes has improved, conduct of the staff has improved, and last but not the least, I would request the media. You see, there may be 1% doctors who are not ethical, but there are also 1% journalists who are not ethical. So a few days back, there was a spat in Jagrao Hospital. The lady doctor, you see, she had performed a cesarean section at midnight when the journalist was speaking. So when she came in the morning, she was late by 15-20 minutes or half an hour, and the journalist was harassing her. It's a digital kind of thing. That's very bad. That should not happen. Because doctors, we don't have any working hours. So I request the media that doctors are full of compassion. They are, you see, they go out of their way. They don't see their comfort. When their patient is in distress, doctors are in distress. So I expect that the media will be more kind to the doctors, try to understand their problems and not try to harass them. And I appreciate that the highest standards which Tribune has maintained it, the entire media, they will do the same standards. I thank you very much, the Tribune group, for giving me this opportunity to share the vision of the Punjab government. We are looking forward to be a very, you see, if the society is healthy, only then you can progress. That's the first, I think the first requirement. The second is education. These two parameters are very, very important for human development. So if you have a educated society, if you have a healthy society, rest all, we can do everything else. We can make a lot of, you see, Indians are, particularly Punjabis, are very innovative. Punjabis are successful wherever they have gone. And they are super hit in USA, they are super hit in Canada, they are super hit in everywhere, wherever they go. But we will make sure that they are super hit in Punjab also, and we want. You have to decide what kind of Punjab you want. It depends on our collective effort. I think when I was a small child, I got beautiful Punjab from my parents. I inherited a beautiful Punjab where the air was pristine, now not anymore, where the whole water was pure, not anymore, the food was toxin free, not anymore. So we have to, you see, I can talk only to you about these issues. I cannot talk to the laborers, which are a poor fellow. What do they understand about the environment? They are concerned about ration or any other, you see, facility. So we have to give our children a Punjab which is full of life, where the air is pure, where we have the brotherhood, where the water is pure, where the food is toxin free once again. We must, I think we owe it to generation next. So that is my pledge. So let us work together and make Punjab Rangla Punjab as envisioned by our Chief Minister and envisioned by our national convener. I thank you very much for your kind attention.